Hi, everyone. I'm Connie Zabo-Schmucker, Advocacy Director for Bicycle Garage Indy, and welcome to Spotlight on Bicycling. Tonight I'm joined by Logan Lane and Taylor Firestine from Health by Design. So we're going to learn a little bit about what Health by Design is doing with regards to bicycling in central Indiana and actually statewide as well. Next week, we have Commuter Connect. And for those who came to the first Spotlight on Bicycling when we had Bike Indianapolis, they talked about having a program pairing an experienced cyclist with somebody who wants to get out and bike more in their neighborhood. And Commuter Connect and Bike Indianapolis have started this program called, I think it's Bike Guides. And they're going to be talking about that next week, as well as their efforts to get people to commute by bike and the programs that they have for encouraging people to get out of single occupant vehicles. So, and I've got some other programs getting lined up in the rest of this month and in June that I'm kind of excited about, but they're not totally firmed up. So I will let folks know as soon as I get them firmed up. But thank you very much for coming, and I will turn this over to Logan and Taylor.
Hi, everyone. Connie, thank you so much for having us. We enjoy doing these sorts of things. So with that, let's get started. First, before I introduce myself and introduce Health by Design, I wanted to pose a question. The first question is, why do you bike? So Cora, Ron, if you can come off mute, or if you want to type it in the chat, feel free to let us know what is your interest in bicycles? Why do you bike?
So I just bike just to be able to be outside and enjoy the outdoors, and also to have some exercise and for a health benefit.
Awesome. Ron, if you can come off mute, feel free to do so. If you can't, that's also okay.
He put something in chat.
Awesome. I can't see that.
Yeah, like to ride, feel of the bike.
Awesome. That's great. One of the things that we are really focused on at Health by Design is thinking about who is riding and why are they riding. For instance, for me, one of the reasons why I ride is I'm riding to work. I enjoy riding for fun, but my primary use for the bicycle is to get to and from work. Taylor, Connie, any thoughts about why you ride?
Sure, I can go. I ride for quite a few reasons, but I would probably say just relaxation. I feel like when I'm on a bike ride, I'm not thinking about all the issues and problems and worries. They just kind of drift away, and I'm able to just kind of be in the moment and be present. So I think that's probably my favorite part of riding a bike.
Ron also says transport and commuting. And I ride for all sorts of reasons, but this last year I rode for sanity, because it was my way to I got outside nearly every single day, and I take lots of photos. So often I'll go on a photo bike ride where the whole purpose is to just stop wherever I want and take photos of nature. And that just really, helps me. It's almost like a meditation for me to stop and view the nature that I see. And I have a really wonderful bike ride that I do, and they extended Fall Creek Trail last summer, so it got longer. But I live near Fort Harrison State Park and Fall Creek Trail, and just surrounded by nature. But I also do commuting. One of the things I really like doing also is to lead bike rides of all sizes. And I wasn't able to do that last year, but that also, helping people find interesting areas to ride. So let's see.
Awesome.
And then we've got a couple more comments. Exercise to keep out of our cardiologist office, and great for our physical health and our planets.
Absolutely. Absolutely. So the next question I have is, who else is riding? So why else would you ride a bike? I know we had exercise, that tends to be like a big category. We have commuting, that's another big category. Why else might you ride?
I ride to explore an area. Like anytime I go on vacation, it's we take our bikes and we explore an area by bike.
I would also challenge you all to think about what type of bike riders are there? Like for instance, you have the bike messengers. That's another category of bike rider.
I'm definitely a casual bike rider.
There you go.
I don't know any of the spandex or anything like that. I just go out in my shorts and t-shirt and have fun.
Yeah. Think of, folks who are riding not because they can commute on a bike and may have a car, but they opt into the bike because that is their option. You've got the mountain bike crowd. You've got people like you, Taylor, who are very interested in just sort of following the trail and going for as long as you feel necessary for mental health reasons or what have you. So I would challenge you throughout this whole time to sort of think about that. Who else is riding? Why are they riding? There is a massive group of bike riders around the world, around our state, around our city, and more. It seems for some reason that we don't always agree. The mountain bikers want certain things, the commuters want certain things, the people who are riding because they may not have a car or they choose to ride a bike, they have different ideas about how to best suit their needs. And so I would challenge you throughout this presentation to think about that. And if you take anything away from our presentation tonight, to really think about who else is riding and how can I, as a fellow bike rider, work together with other types of bike riders. So just a little beginning there. And I just wanted to start by saying, again, my name is Logan Lane. I have an urban planning background from Ball State. I am a walk and bike program coordinator with Health by Design. And I have my colleague here, Taylor, and I'll let him introduce himself.
Yeah, good evening, everyone. I'm Taylor Firestine, also a walk and bike program coordinator with Health by Design. And just like Logan, a graduate of Ball State in urban design and urban planning and development.
Awesome. Thank you, Taylor. Just to give you a little bit of overview of what Health by Design does. Health by Design works at the intersection of the built environment and public health. So like Taylor and I just said, we are urban planners. We are predominantly working in the built environment, specifically with transportation elements of the built environment and how we can better that for walking, biking, transit. And that also means looking at land uses. So how do different businesses or different types of uses of land, housing. How does that affect multimodal transportation? Also on our staff, we have a series and several public health professionals. This helps us really think about how does multimodal transit and planning and public health, how do those things go together? So often public health professionals are thinking the same thing as folks like Taylor and I, but we don't always talk. And so something really great about the organization is we're able to sort of smash those two worlds together and think through how to better our built environments through the two fields working together. And so among public health professionals and urban planners and designers and architects, we're also collaborating with other community businesses across sectors and disciplines to ensure Indiana communities have public space and ways that an infrastructure that promotes active living. And we sort of, like I mentioned a second ago, we sort of work in the walking, biking, transit, and land use categories. Our goal is to advocate for policy change. How can we influence policy that benefits bikers, benefits walkers, benefits transit users in the best way we can? How do we build community capacity? How can we work with different community organizations to better their understanding of how to advocate for themselves? How are we able to get partners together? Like I said, those different types of bike riders. More often than not, those folks don't get to hang out with each other. How can we get everyone together in one room and talk about how we would like our infrastructure to change for the better for biking? How do we educate folks on best practices? So often, we get to talk to residents who are like, I have this infrastructure issue and I don't know how to go about it. I think I know who my counselor is. So we get to like walk through some of those really hard questions to help folks kind of figure out how to navigate some of those systems, and then be able to share those things with others in their neighborhood. Facilitate dialogue. We were able to get folks together, whether that be city people, whether that be community organizations, to talk through different infrastructure needs together and work together on those things. Promoting smart design. So what is the best thing for walking and biking? What are the best practices? And then also providing technical assistance. So oftentimes in our state work, we're working with different small communities to sort of help them figure out what it looks like to be a city, to be a town that promotes walking and biking and is able to sort of progress those initiatives that they have. Just a note, our colleague Marjorie Hennessy is predominantly working with our statewide work. As Connie said, we do work across the state. Taylor and I are here in Marion County and are focused directly in Indianapolis and work very, very closely with the Department of Public Works. So that's sort of our field of our position. So one thing we found out through our work over the years is that place matters. We found out that your zip code affects your health. Are you able to walk to the grocery store? Are you able to walk in your neighborhood to get exercise? So often people feel that their need for exercise has to be done in a gym, right? And we imagine communities that may not need that because you are walking or riding or having active lives throughout your daily tasks that you're doing. This goes to thinking through education. How is where I live, where my zip code affect the education that I get and upward mobility? So place matters. And specifically on our work, we're working in Indianapolis to make sure that biking is possible, that whether you're in downtown Indianapolis in urban neighborhoods or you're up near Castleton where it's more suburban oriented, how do we work with those communities to make sure that biking and walking and transit use is efficient and easy to use for all residents. I wanted to explain to you sort of like the nuts and bolts of our work. We have a partnership that goes back to 2010 with the Marion County Public Health Department that collects crash data. And when I say crash data, I specifically mean pedestrian crashes with cars. In that partnership, we map those crashes, and then there's a formula that goes crashes over landmass area. So you can see here, there's some circles. You kind of, essentially this sounds funny, but you look at where there are clusters and you draw a line, and if that landmass area, if that mileage of area, if the crashes over the mileage of area is over 3, then it's considered a crash zone according to the National Highway and Transportation Association. So all that to say, and I know that's pedestrian work, all that to say is in Marion County, we've got 403 square miles, but 45% of all pedestrian crashes occur in only 7% of that landmass. Now, we haven't officially started working with bikes. Connie will know we've been long-standing partners with her and BGI that we are absolutely advocating for bikes, but we don't work directly with collecting crash data like this with the city. However, that is changing. Instead of just kind of going on a case-by-case basis and doing more advocacy work than data collection, Help by Design will be soon collecting crash data for bikes and then working with organizations to sort of figure out what are the best needs for those communities, as we do with our pedestrian safety work, which Taylor will do an overview in the next slide.
Thanks, Logan. Yeah, so this is kind of our flow chart as it relates to our community champion work. And so traditionally, this has been done specifically for pedestrian crashes in those kind of high crash areas that Logan mentioned. And so we've kind of broken it into pieces where we have 3 phases. The first phase being kind of the assessment and information gathering phase of the program. And so that's when we're kind of doing a desk scan of what kind of plans have already been done in the past, maybe collecting dust on the shelf and maybe didn't get the implementation or attention that it deserved. And then also just kind of seeing where people are walking generally, where are those kind of destination drivers in the neighborhood where people are walking and where they would feel more safe to, or improve safety for people walking to those destinations. So that's kind of like laying the groundwork. And then we, moving into phase 2 with our community champions, we work with them on kind of formulating a community outreach and engagement strategy. And so through that, we're able to work with them to figure out what kind of grassroots level activities could benefit the residents of their neighborhood the most, to get them active in the conversation about walkability. And so from those kind of actions or kind of these engagement opportunities that we're able to work with our walkability champions on, we end up having, and we just finished this up in March, what we call walkability workshops, where we literally kind of workshop out with the residents in that crash zone to kind of brainstorm ideas and solutions that get to the system level issue around walkability and improving pedestrian safety. And so from there, we at Health by Design kind of take that public input and take it with our phase one kind of information gathering and data analysis, and we package it into what we call an action plan, along with our community report. And so that lives with the Walk Champion and the Community Hub, which is usually a nonprofit organization or other kind of trusted institution in the neighborhood. And then they kind of have a guide, a step-by-step guide of those priorities that they would like to see change either in the short term or in the long term, along with kind of a plan of action. So that includes, funding opportunities, if there are grants out there that could help pay for something, new connections with people at DPW, Department of Public Works, to kind of bridge those communication gaps with the neighborhoods. So really it's a huge benefit for everyone involved. And then moving into phase three is more the implementation piece, where we actually see the action plan being kind of put on the ground and seeing and measuring how it changes and evolves in the neighborhood, and what lessons can be learned, what are things that maybe were missed that could be included in a more permanent solution, which is kind of the evaluation piece. And so we share this as kind of the overview of our Walk Champion work, to say that this could possibly expand into something when we talk about data analysis around bikeability and bike crashes in Marion County. And I'll talk a little bit more in detail on kind of why we've been more focused on the pedestrian side of things. But looking into the future, we're definitely setting ourselves up more for having that conversation around bikeability and bike safety in Marion County. And so first, I just wanted to kind of highlight some of the work that we're doing right now as it relates to our walkability program, but can also very easily be used to improve bicycling safety in Marion County. And so one of those areas we call tactical urbanism. And definition of tactical urbanism, this is one that we've used through our Walk Champion program. Basically, it's a citizen-led, community-driven approach to neighborhood building, using short-term, low-cost, and scalable interventions to catalyze long-term change. So basically what that means is the community gets to kind of decide how they want to rearrange the right-of-way, basically, to improve safety, and that could be lower speeds, so narrowing the street forces motorists to go slower. It could be an art project, so something that brings the community together. As you can see in this larger picture, this was done with Big Car on Shelby Street near Garfield Park. And so I believe that was done right around the time that the Red Line opened down there on Shelby Street. And so this is kind of a good example of another term that gets thrown around a lot, of like community placemaking. So making it kind of a recognizable piece that the neighborhood has a hand in creating, and it really kind of fosters that connection with your neighbors. And then the other example I wanted to highlight there in the kind of smaller picture there in the bottom left is an example actually from the city of Fort Wayne that was able to use tactical urbanism to do a pop-up bike lane. So you can see that kind of purple lane there is their pop-up bike lane, and then they were able to use little delineator posts to kind of move the parking spaces over into a different, or what was a traffic lane. And that way you're, again, narrowing the street so that there's, less real estate for cars and slows cars down from going over the speed limit. And it also creates a barrier between bicyclists and pedestrians who are now using a larger area of real estate in the right of way. And it's also, again, just kind of a cool idea. You can see they put some planters there in the picture at the crosswalk where the parking lane ends. And it's just a fun way to get people out in the community and thinking about how they can re-envision their streets to work best for them. And that definitely helps both pedestrians and bicyclists. And so I just wanted to mention, so our public ally at Health by Design and our colleague Kinsey Isaac is leading that on our team this summer. And so she has been in communications with DPW and BNS and other relevant organizations on piloting a tactical urbanism project in the Martindale Brightwood neighborhood as a way to seek safer and more efficient connections for bicyclists and pedestrians between the Monon and Frederick Douglass Park, which is actually celebrating its centennial this year. And so it's a really timely project. And then there's another idea that has evolved from this, from our communications with the neighborhood, and the possibility of painting a mural at the intersection of 25th and Sherman near the new Martindale Brightwood Library branch. And so that's just another example of how we're shifting how we're thinking about our public space and how we use it and how we can manage it in a way that we're not punishing people in cars. We're trying to reallocate the space so that there's room for everyone, and to make it a more equitable way or mode of transportation for everyone of all abilities and ages. And then a couple more examples I just wanted to mention too, is as far as the tactical urbanism project, we've also been working with the MLK Center and Crown Hill Neighborhood Association in the Midtown area on a project that would basically be community-driven installations of crosswalks in the neighborhood there at some of those high crash and dangerous intersections. They're in one of our kind of top crash zones in Marion County. And so DPW is assisting in that partnership and trying to pilot that as something, kind of a tool in the toolbox that other neighborhoods can possibly learn from and use. It benefits DPW by kind of dispersing the workload a little bit onto those members of the community who can volunteer their time to do it. But it also, again, allows for this kind of fostering environment where connections are being made between decision makers at DPW and the neighborhood residents themselves, and being able to kind of measure that impact and see how successful they are and what lessons they can learn before they kind of open that up to other neighborhoods. So I feel like there's like so much more I could talk about on this. I know to keep it short, we're also working with DPW on adopting a more permanent internal policy, so that when neighborhoods come up with ideas that involve tactical urbanism, so especially when we're talking about bicycling, these pop-up bike lanes are really popular in a lot of cities. If a neighborhood organization or association came to DPW with an idea for this, that there would be an internal policy for them to basically check the list and make sure that the project's meeting kind of the safety criteria, that's the liability issues that DPW deals with, and then they're able to eventually sign off on those and even assist those communities in getting something like this on the ground. So there's definitely a lot of moving pieces to this, and it's a continuing conversation. So it's always evolving, but definitely really exciting as we kind of talk about tactical urbanism in Indianapolis and what that looks like in the coming years. So definitely really exciting. And then, yeah, next, I just wanted to touch on safe routes to schools. So Safe Routes is a program that is focused on bicycle and pedestrian safety for children or kids getting to school. And so we felt it was timely to talk a little bit about this, as we've internally been working together on putting together a work plan on how we can better support our public school systems here in central Indiana, and how we can kind of give them the tools to prioritize walking and biking as transportation issues at the systems level. Because we know, just kind of over time, we've seen how development has happened in central Indiana, and we've seen this departure from maybe the traditional neighborhood school to more of a school in the middle of a cornfield kind of idea. And so you have these suburban subdivisions that have kind of popped up, kind of leapfrogging around and building these massive schools kind of on the peripheries. And so it's not the easiest, definitely not as easy as it used to be for kids to walk or bike to school. And so this program is just kind of bringing more attention to that and what we can do at the systems level to kind of change the conversation and move it back to definitely the benefits of physical activity for kids that walking and biking to school provides, the sense of independence to allow them to power themselves to get to school. And so there's a ton of benefits with safe routes to school, but it especially became timely with IPS's new walk zone policy. And I've included a link there, and I'm sure we can share the presentation out with anyone in attendance, that we can give you the live link so you'll be able to get to that page. But IPS has had some town halls recently talking about this new policy, where they'll be instituting walk zone policy for students of all the schools within, definitely if it's an elementary school, they have kind of X amount of mileage that they can walk, and then it kind of moves up gradually from there to the middle schools and then high school. And so when we talk about walk zones, we're also talking about bikeability, and if kids feel safe walking or biking to school, and if we have the proper kind of accommodations, the infrastructure to support them safely getting to school, whether it's a bike or walking. So it's definitely a timely issue that we wanted to address. And so we're having those kind of, again, internal discussions on how Health by Design can be a support locally for IPS, and then also other school districts that maybe in the near term might be seeing budget shortfalls and need to rethink their transportation policies for their students. And then one more thing I wanted to mention as it kind of relates to safe routes to schools. The MPO recently released a regional bike network analysis. And so it basically analyzes the stress for bicycling across the roadway network. And so where people have more, if there's lower speed limits or narrower streets where people are going to feel more comfortable bicycling versus trying to think of a good example, like trying to bicycle on Shadeland or 86th Street. Some of those really busy, highly trafficked suburban streets are good examples of what we're looking at when we look at high stress versus low stress networks. And so I should also mention The MPO is the Indianapolis Metropolitan Planning Organization. And so they're the federal conduit or federal funding conduit for all the funds that come from DC to central Indiana. And so that is a really cool kind of interactive map that shows you where the streets are in the network that are probably the most comfortable for people bicycling versus those that currently are pretty dangerous. And so that's also really helpful for DPW as they begin implementing in the next few years the Neighborways plan that was put together. That's kind of on the same level of thinking on a low streets network, how to kind of systematically connect people across the city into the network safely. And then from there, I'll just talk a little bit about our bike crash analysis. So circling back to kind of the what we talked about at the beginning with our pedestrian crash data, we are now working with DPW to finalize a methodology for collecting and analyzing bike crash data in Marion County. And so basically this methodology was derived from a combination of the City of Chicago's Vision Zero analysis and the Columbus, Ohio MPO. And again, that's Metropolitan Planning Organization. And so by kind of standardizing the process, we're hoping to have similar results from our pedestrian safety work, where we'll be able to map where bike crashes are happening, get a feel for the trends over time. So year over year, where the crashes are happening at certain areas, corridors or intersections, or seeing increases or decreases in crashes over time. And so then through that analysis, we would be able to help DPW in identifying possible interventions for those corridors and intersections where crashes are happening, which ties directly back to tactical urbanism. So for example, if we're seeing a spike in crashes at an intersection, we might look to working with the community, businesses and institutions right there around the intersection to see if there's interest in a temporary pop-up bike lane, or maybe curb extensions that can be painted on the roadway as a way to test over time and measure and see if that makes a measurable difference in the number of crashes or close calls that motorists and bicyclists are having at that intersection. And then if we see positive results, then that gives DPW the kind of wherewithal to make it a part of their budget so they can get something more permanent on the ground there. So just wanted to make that connection there between tactical urbanism and bike crash analysis. Let's see, one thing I did want to mention on this one too is the system where we're able to collect the data. So wherever we're able to find where bike crashes are happening versus pedestrian crashes, that's called the ARES system, and it stands for Automated Reporting Information Exchange System. And basically it is the police reporting system for all crashes across the state. And so we have access to that, and we're able to basically decipher from those police reports what kind of crash is happening where, when it happened, the date, the circumstances. However, there have been some discrepancies in how officers who respond to a particular incident are reporting those. And so the state is working on kind of fixing where those discrepancies are happening to improve the integrity of the data. And that way, when we're coming back to look at bike crashes that happened in 2021 next year, we'll have more of a standardized reporting from officers who responded to an incident. And then we'll be able to actually more accurately map that information. But that's kind of an explanation for why we focused more on the pedestrian side as opposed to the bicycling side, because for a multitude of reasons, bicycle crashes tend to be misreported or even coded as pedestrian crashes, or and then you involve the now scooter share, and it can really quickly become a confusing issue as far as reporting. So they're working on that, and that'll definitely improve the accuracy of the data that we're looking at. And yeah, this is just an example. I should have mentioned that at the top. This is an example of bike crash analysis done for the city of Chicago. So you can kind of see a heat map there of the instances of crashes, as well as the one on the right looks more at the corridors and intersections where crashes are happening. So that's kind of something along the lines of what we would like to see in the next few years as we begin putting this methodology to use through the Aries crash data that we have access to. Yeah, I think that's it. So I think at this point, I will send it back to you, Logan.
All right. Thank you, Taylor. Something we wanted to mention as we sort of wrap up is thinking about how do these multimodal transportation methods, how can we work with them together to make not having a car possible? Or how can I get around using all of these methods? Maybe it's I ride my bike from my neighborhood to a bus stop. And the reason why I ride my bike from my neighborhood to the bus stop is there is a trail, and that trail leads right to the bus stop where I can hop on the bus with my bike and get to work. In some instances, how can I use like a car share to get to a bike share station to get to work from there? So any of those multimodal, transit methods, how can we work to integrate those? There's been some conversation with Pacer Bike Share over the years and Indigo about how we work better with those organizations. How do we connect things like transit passes together and make bike share be able to use your transit pass for the bus? That is not necessarily a possibility yet here in Indianapolis, but those are conversations that are currently happening in the city. So just wanted you to be aware of that. And then lastly, thank you all. And if you all have any questions for us, I know we typically use some jargon. So if you all have any questions, if we've kind of thrown some jargon out there that you didn't understand, feel free to ask us those questions and ask us any other questions you might have. Can I ask you
Yeah. Will the
your
blue line
question?
have a better bicycle interface?
Thanks, Connie. So can I ask you what you mean by bicycle interface, just so I'm clear?
That's from Ron Cooper, so he'll have to answer.
Yeah. I see. So you're talking about the actual sort of like where you put your bike when you get onto the red line. That is a question I do not know. I know that Indigo has talked about the sort of middle console bike holders in the red line there in the sort of accordion part of the red line buses. I am not sure. As far as I know, it's the same infrastructure, but I that is a few years down the road, and I think they're certainly looking into how to accommodate bikes better. But that is probably an Indigo question.
So I have a question regarding, I live on the south side, and there's been a lot of work that's done with bike paths and everything up on the north side and downtown and, in Fountain Square area. But in where I live, which is still in Indianapolis area, there may be a bike lane on Madison Avenue, but it is skinny and narrow, and the drivers don't really pay attention to it. So for me to be able to bike downtown or to get to Fountain Square, just to get to a reasonable, safe place where I feel like I could bike the rest of the way, is dangerous. So, and I really don't have good, bus down here either. So in the future plans, is there anything about expanding, biking here on the south side area?
Yeah, so that is a conversation, and Connie knows this as well, that we've been having with several of the organizations that we are partners with. The city is very aware of that, and is looking at ways they can advance bike infrastructure in the community, but I don't think there is a very, very clear plan on how to say implement something like a tactical urbanism project in the meantime to then make that more accessible. However, the city does have plans for Neighborways. Currently, the southeastern area, Beech Grove area, has a Neighborway plan that was presented, I believe, in the summer of 2019. That was a part of the original Neighborways program, where essentially you would be taking streets that are already more neighborhood-like and a little bit more bike-friendly, and sort of putting down some infrastructure to make them a little bit more, even more friendly for bikes. However, I am not aware of permanent infrastructure that is going in. And that is certainly a concern of the cities, and I'm hopeful that we'll have some more infrastructure in the southern area of Indianapolis, because it's certainly needed.
Yeah, and has been for a long time.
For a very long time.
So now I drive to the, downtown and then bike from there. And it's sort of like that defeats the purpose of getting rid of my car.
Absolutely. Yeah, and that's one of the things that Help by Design exists for, is advocating for folks like you, where you might think about getting rid of a car, but it's not possible for you.
Right.
And that's what we want to get to. We want to make sure that we get to the point where people have the option to get rid of their car if they would like. So.
Great. Okay. Thanks. This is very interesting.
Ron, I agree with you. I can't countless times have carried my bike onto the red line and have had a disastrous experience. And I think, the folks at Indigo know that that's an issue, and I'm sure that they're looking into it, but I just don't have a specific answer for you there.
Yeah, so Cora, I just want to also reiterate what Logan said about the south side, but also it is crucial for people on the south side to talk to their city county council people, because unless there is groundswell from their constituents, they're not going to be your champions for bike infrastructure. So they need to hear from people who are in their districts that this is an important issue for you. And, going forward, there's all sorts of reasons to make Indianapolis more bicycle friendly. We have COVID, so people need to be outside and more and healthy so that they will be better able to handle any kind of health issues. It's also less expensive for people to be healthy with health insurance, but also with climate change and having more people out on bikes rather than in cars. I've always said you shouldn't have to get in your car to go for a bike ride. You should be able to ride from home to wherever you want to go. And I know that we're not there on the south side at all. Bicycle Garage Indy has a store on the south side of Indianapolis.
Oh, yeah. Been there multiple times. Yeah.
And, we hear that from our customers a lot. Where should I go ride my bike? And, unfortunately, we don't have a great answer. And I would love to be able to have a great answer. And I think it starts from people going and talking to their elected officials, not just to DPW, but to your city county council people, because they actually have the power of where money gets spent in their district and how it gets spent. There actually was a city county council person that was not in favor of a bike lane, not on the south side, but in a different location in the county. And there are a couple of blocks that don't have a bike lane because of that. There was a constituent that didn't want it in front of this area. And so they hear from constituents and they're able to go in and change things. Hopefully they would change things for the better, and have, let's say, Madison should have a protected bike lane. It's got, and the traffic on Madison there's enough traffic and the lanes are, and the speed is high enough that it should be not just a painted bike lane. It needs to have a delineated, at the very least, and a protected bike lane. But people need to talk to their city county council people to let them know that I want to ride my bike, and there's, this bike lane is not going to cut it.
Right.
And that's the only bike lane on the whole south side. I think Shelby Street has some farther.
And well, it will gets up closer, the closer you get to Fountain Square.
Yeah. Around Garfield Park,
Right.
there is a bike lane, but I don't think it goes much
No.
farther than that. And then Madison itself, I've been talking about Southport Road for 30 years because Southport Road is the only crossing of the White River in the whole southwest quadrant of Marion County that is not an interstate. It's either Raymond up farther north or Minnesota, I think, farther closer to downtown, and then Southport, and that's it. Otherwise, you have to go out of the county in order to cross the White River. And so Southport Road obviously has gotten extra lanes. It's gotten additional infrastructure put on in the last 30 years, but nothing has been done to make it more bicycle friendly. And that's a key connection to get over to Southwest Way Park, where there's mountain biking, and for people to get to this regional park, as well as the people who live in that area. So anyway, that's having data to back up things really helps, which is where Health by Design comes in with the crash analysis. As you could see from the data that they have for pedestrians are a little easier, easier to collect crash data because unfortunately there are more crashes that involve pedestrians than there are bicyclists. So you kind of have to look over a longer period of time to see some of the crashes. And I would say also, if there aren't people out bicycling because there's not infrastructure, then there's not going to be as many crashes.
Right.
So, just because there's not that much in the way of crashes in the Southwest and Southeast quadrant doesn't mean that there aren't people who want to bike. And so, if you look at where the crashes are for bicycling, it's mostly where there is already infrastructure because people are already going there. And so you have to find, why aren't people riding in these areas? And actually in a meeting recently, I showed the Strava data, the world map for Strava, that shows where people are bicycling in the southern part of Marion County. And there are a lot of, granted, Strava has, whoever uses Strava is different, but a lot of it was in neighborhoods. People are doing lots of loops in their neighborhood because there are no connections from one neighborhood to the next. They're not going on long rides. They're going on short rides in their neighborhoods. And to your point, you probably would love to be able to ride from where you live to get to downtown and get to some of the other infrastructure that already exists. But you feel you have to get in your car to do that. So anyway, having data, but also figuring out where people are not biking because there's not infrastructure, which means they're not going to have the crashes because, they want to bike, but it's not happening. So anyway, we're going to go ahead and end. I want to end on a positive note.
Happy early bike month.
Yeah. So, happy early bike month, May, and we're going to encourage at Bicycle Garage Indy, we're going to be encouraging people to get on your bike. There is the first ever Ride a Bike Day on May 2nd, Sunday, May 2nd. The League of American Bicyclists is starting, which is really good. And they also promote Bike to Work Week and Bike to Work Day. And all month is bike month, but so Bicycle Garage Indy, what we're going to do is encourage people to, so each week we're going to have a theme. So it's like bike with your family, bike to work, bike to the park, bike to the 500. So we're going to have some encouragement where people can use the hashtags and share some photos and things like that to encourage people to do that. So if anybody has anything else to add, go ahead and do that. And then otherwise we will.
Thank you so much, Connie. We really appreciate it. We love doing
welcome.
this stuff.
Thank
Yeah,
you.
thank you.
Thank both of you, and thank Cora for joining us, and Ron. And this will be up on our BGI's YouTube channel, so people will be able to see it as well. But thank you very much, and have a great week.
Thank you all. It was very interesting. Appreciate it.
No
Thanks.
problem. Thank you.
Take care.
Goodbye.